Mr. Smith, my name is Thomas. I'm going to be your PICC nurse today. How are you?
Good, how are you?
Good. So we're going to go over this procedure. You're going to get a PICC line. Have you ever had a PICC line before?
Nope.
All right, so this is a PICC line. It's a fancy IV catheter. It's going to go into your upper bicep muscle area. It's going to travel all the way to your heart, and it's for long-term antibiotics today. I got a couple risks and benefits to go over with you. Anytime we poke a hole in the skin, there's an obvious risk for infection. However, we keep that risk pretty minimal by you coming down to the room. We're going to do it as a sterile technique. Anytime we pass a needle into the skin, there's a risk of injury to the vein, including entrance of air into the vein, injury to the artery or nerve, and an irregular heartbeat. Also, anytime a patient is in a hospitalized setting, there's the unpredicted risk of death. So if you agree to this, I'm going to have you sign right there. All right. So we have informed consent, and what we're going to do now is we're going to do our safety timeout to make sure who you are, who you claim to be, and we got everything all set. So I'm going to take your wristband here. Are you ready, Karen?
Yes.
In front of us we have John Smith, birthday 3/7/1984, medical record number 0736845, check 7. We have permission to do a double lumen PICC for antibiotics. My name is Thomas. I have no safety concerns.
My name is Karen. I'm the X-ray tech, and I have no safety concerns. We have an order in for the imaging, and the patient's name is brought up on the CR.
All right. All right, Mr. Smith, at this point, we are going to get started. So I'm going to wash my hands, and we're going to go.